And hello, everyone. Welcome to the Steve Malzberg Show. I'm Bill Tucker, filling in for Steve. Steve has a well-deserved day off today. We're going to kick off the top of the show talking about Obamacare, the Affordable Care Act, whatever you want to call it. It's in big trouble. Whether Secretary Clinton won the election or Donald Trump, as he did win the election, it is a number one priority in terms of what needs to be addressed and what needs to be fixed. Joining us now to talk about that is Sally Pipes. She's the healthcare policy expert and president of Pacific Research Center. She joins us to discuss the future of the Affordable Care Act, aka Obamacare. Sally, thank you very much for being here. Before we start our discussion, last night Donald Trump was on 60 Minutes and he was asked about Obamacare. It's slot number 10. If we could bring up what he had to say when asked about Obamacare, let's hear what he had to say.
Replace it. Are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that.
Also, with the children living with their parents for an extended period, you're going to keep very much try and keep that. Adds cost, but it's very much something we're going to try and keep. We're not going to have like a 2-day period, and we're not going to have a 2-year period where there's nothing. It will be repealed and replaced, and we'll know. And it'll be great health care for much less money.
Sally, the much less money part is where I want to start this conversation. A recent survey of Americans found that most of us can only afford about $100 a month in terms of health care insurance. I don't think that's possible. But give us your take on what's next for Obamacare.
Well, I think the president-elect definitely said his first priority is repealing and replacing Obamacare.
Right.
He said he would hold a special session right after the inauguration on January 20th. He is committed to it. The mainstream media seems to think by making those statements he made on 60 Minutes with Leslie Stahl about pre-existing conditions and children being able to stay on their plans, their parents till age 26. Those were in his original 7-point plan. They're also part of Paul Ryan's plan, A Better Way, and it's part. It can be done. I think the replacement plan is important. I think if Trump can follow Paul Ryan in A Better Way, we'll definitely see costs come down, because if we have more options, get rid of individual mandate, the employer mandate, the essential benefit, they can offer coverage at a lower price, and also keep people with pre-existing conditions covered by making sure that they have continuous coverage if they keep up their payment, and also by putting $25 billion over 10 years into the high-risk pools so that these people can get coverage, and it'll take the pressure off those people who are younger and healthier for their coverage.
Yeah, it's very interesting, Sally. There are two things that seem to get lost when you see in the mainstream media coverage. One is there are at least 2 plans on the Republican side that are set to be moved forward in the House for this, on how to repeal and replace Obamacare. And second, it didn't matter who was going to win it. Obamacare was going bankrupt. It had broken all of its promises, in addition to going physically bankrupt. It broke its promises to provide affordable health care to Americans. Rates have been going up at a phenomenal rate. How do you do that little weird, I know it's a process question, but you've got to take one down and put another in and not let people suddenly be without health care for an extended period of time, which could be disastrous.
Right. Well, I mean, there's no question Obamacare was in a death spiral. The premiums were going up, the deductibles. An average family with a bronze plan was going to face a deductible next year of $12,000. Insurers were exiting the market. 17 out of 23 co-ops had failed. I mean, Obamacare was in a death spiral. The president-elect wants to repeal and replace. I think this will be done through budget reconciliation, because in that way they only need 51 votes. It would be hard to, get it done through the normal process, because the Senate, they don't have 61 votes in the Senate. So it can be done, it will be done, and the plan that we're talking about would allow those 22 million people who have coverage, either 12 million through the exchanges and 8 to 10 million through private individual coverage. There will be a transition for those people. But if we take away these mandates, insurers will offer plans that fit the needs of individuals and families and not have all of these mandates which bump up the cost. We will reach affordable, accessible, quality care for all.
You sound like you might think this won't be a bipartisan kind of thing. I think even there have got to be Democrats who recognize that if they want to save President Obama's signature piece of legislation, they need to fix it. Don't you think they could align it with Republicans on this?
Well, I don't think there is, because Obamacare was passed with not a single Republican vote by Democratic members of the House and the Senate. So I think with the Republicans now having the presidency, the House, and the Senate, they don't really need bipartisan support. But I do think there will be some Democrats that are more conservative Democrats that probably might buy into repeal and replace of Obamacare, because the law is in a death spiral, and their constituents were not, pleased with the high cost of premiums, the high deductibles. Obamacare wasn't working for them.
All right, Sally, thank you so much. Sally Pipes, healthcare policy expert and president of Pacific Research Center. Thank you.
Thank you.